So what I'm going to do is I'm just going to hand you over to Rachel to introduce herself, and then you'll come back and we'll have a go at CPR.
Hi there everybody, I'm Rachel from Bouncebackability and it's lovely to meet you all.
Thank you for that, Rachel. It's going to be a great session after we've covered the children's first aid session. Right, so what we're going to have a look at now is probably every parent's worst nightmare. We're going to have a look at what happens when you get to a child and they're not breathing. So it's really important that we can start CPR and keep their brain fed with oxygen until the paramedics get there. So first of all, what we need to do, obviously we need a body. So this is Billy, and we get to Billy. And first of all, it's really, really important that we check to make sure that we know that the child has a problem and that they're not breathing. So we're going to use a mnemonic to do this, and we teach this in all of our first aid classes. It's exactly what all of the emergency services use. All first aiders are being taught this, but it really helps us make sure that we are performing CPR on somebody that needs it. So first of all, what we need to do, the mnemonic is Dr. ABC. So the D stands for danger. So first of all, it's really, really important that you make sure that you're safe before you start helping the child. It's one of a natural parent's instincts that if your child's in difficulty, that you run and rush into the scene. Just remember, if little Billy drops his ball, gets out onto the road, gets hit by a car, if your instinct makes you run onto the road, you're putting yourself at great danger. And even though you're trying to do the best for the child, if you're injured yourself, if you've been hit by another car, you can't help them. So it's really important that we fight that instinct and just have a really good look and make sure that the scene is safe before we do anything. After we've checked for danger, we need to make sure that the child's responsive or not. So we're going to talk to them. So to start with, Billy, open your eyes. Billy, wake up for me. If you give them an instruction, they're much more likely to respond than just saying, are you okay? So we're going to give them a definitive instruction and see if we get a response from that. Do try and really, really gain a response from them. So, Billy, come on, wake up for me. Billy, open your eyes. So we're really going to get in there and see if there's a response from Billy at the moment. At the moment, we're not getting anything from him at all. So what we're going to do is we're going to give him a gentle shake of the shoulders, tap on the collarbone, just to see if we get a response from some sort of pain or some sort of physical response from Billy as well. So we're doing this quite quickly, but making sure that we're being really thorough for it. So we've done our danger and our response. If we're not getting a response from that child, you want as many people on the scene as possible. So somewhere in that, we're going to shout for help. You never know who you're going to get when you get a bystander. It might be an off-duty nurse, off-duty paramedic. So give a good shout if they're not responding normally to your voice. Okay, and then we're going to move on to their A. So the A is their airway. Now their airway is the tube between the nose and their mouth, and that goes straight down into their lungs. And we need to make sure whether there's a blockage in there that might be preventing them breathing. We might not have a problem with the heart or the lungs, but we need to check first. So what we're going to do is we're going to have a quick look in their mouth just to see if there is anything in there. You might find something like Lego. Let's face it, kids put things everywhere, don't they? It could be food, it could be vomit. So obviously we're just going to have a quick look in their mouth to find out if there's anything in there. If there is something in there, what we're not going to do is start sticking our fingers in there. Just all you're going to do is push that further down into their mouth. And again, if they're in low levels of consciousness, you could end up like that. So all we do there is we just point their chin to their shoulder, and we're going to grab them, and we're going to roll them over so that everything drains to the front. Obviously, if it's liquid, if it's vomit, that's going to drain out. And if something is solid in there and it's catching in their mouth, we can now just hook that out because we're not going to force that down any further into their airway. Now, another problem with their airway might be their tongue. Now, I'm sure you've all heard of somebody swallowing their tongue. You can't swallow it, it's attached. However, what can happen, because it's a muscle, when people become unconscious, that muscle can relax and it just flops onto the back of their throat. So it's a really, really good technique. We've had a look in their mouth, 2 fingers underneath their chin, get a good grip, and we're just going to rock their head back. Okay, so we're going to open that airway up. That, if at all possible, will enable them to breathe, hopefully. Say if somebody's been knocked out or they've become suddenly unconscious, there might not be a problem that's preventing them from breathing apart from that blocked airway. So danger, response, airway. Okay, so we've done the airway check now. Now we've got to check to see if they are breathing or not. When you call 999 or 112, the numbers to get the ambulance, the first question that they're going to ask you is the patient breathing normally? Okay? So we need to have assessed that before we get stuck in with it. So like I say, done the airway check. Make sure when we check the breathing that the airway is still open and I'm going to put my ear right next to their mouth and their nose, and I'm going to check for 10 seconds to see if we can hear any normal, quiet, rhythmical breathing. So what I'm doing is I'm hopefully hearing it, hopefully feeling it, and I'm looking down the chest to see if that chest is rising and falling. Now in those 10 seconds, I want to hear 2 normal, quiet, rhythmical breaths. Now it's quite scary to think that when some people die, they don't stop moving and they don't stop making sounds. There's something called agonal breathing which happens. And so you might get movement still, and you might get some kind of gulping, snoring sort of noises. And this is just the brain trying to stop the body to do something because it's running out of oxygen. So we say to you, check for 2 normal, quiet, rhythmical breaths. And if you don't get that, we're going to move on to the next section. So check for those breaths. If they aren't breathing, this is the time that you're going to call the 999. Okay, so what we're going to do is we'll call the emergency services. If you're on your own, just get it on speakerphone so that you can carry on and proceed into CPR. You don't have time to start doing this. Obviously, if they are breathing, they're unconscious, we're going to put them into the recovery position, which we've done videos on before. Check out the YouTube channel for that. And then we would call the emergency services after they're in that recovery position. So we've done danger response, airway, breathing. And then the C, so traditionally in first aid that means circulation. It doesn't really mean a lot to us as first aiders because we don't check pulses. It means that we have to provide a circulation for them. This is the time where we call and we do the compressions of CPR. So they're your C's at the end of that. Now, what we're going to do with a child, slightly different. If anyone has done first aid before, you'll know at this point we jump straight onto the chest and we start pumping that around. Now with a child, normally when they stop breathing, it is their lungs that have stopped and their heart won't have stopped first, and so it will keep beating until it runs out of oxygen. That means when we get to a child, they've suffered what's called a respiratory arrest, and that means that actually there's no oxygen in the system. So if we start pumping first, we're actually not going to do them much good. So we're going to put 5 rescue breaths into them first, and that goes with children. Children we class as below puberty. That goes right down to the age of 1, and then from 1 to 0, the infant, we do exactly the same as well. So what we need to do the breaths, 3 things you've got to remember. You need to pinch the nose. If you don't do that, when you breathe in the mouth, it's just going to come straight out of the nose. We've got to have the airway open as well, and then you need to seal around the mouth as well. So we're going to give them 5 rescue breaths. So we do 5 rescue breaths. So when I put a breath in, breathe for sort of half second to a second, and then I take a fresh breath out of the side, and I'm actually looking to see if the chest is rising and falling. It may be blocked. You may not see any rise or fall, but we did get the 5 breaths in, and then we're going to jump straight onto CPR with them. Now, the traditional CPR with adults, interlock the fingers, lock the elbows and the shoulders, and get straight into it. Now, this is a child, and I'm a lot bigger and a lot stronger than that child. So just to limit the force going in, I'm going to do one hand, and we're going to get the heel of the hand right in the centre of the chest, and I'm now going to do 30 compressions, okay? Okay, so we've done our 30 compressions now. So we're going to compress about 1/3 of the depth of the body. So that enables you to adapt that from, right from the little ones right up through childhood as well. So we've done 30 compressions. Now we're straight on to 2 breaths, and then we're going to jump straight back onto 30 compressions. So again, pinch the nose, tip the airway back, seal the mouth. 2 breaths, and then straight back onto it again. And that's just the cycle now. So we're going to do 30 compressions to 2 breaths, 30 to 2, 32. To be honest, how I remember this is everybody is 30 to 2, every age group. Kids, 5 breaths first. If you can remember that, it just makes it really, really simple to remember. If you do have bystanders around you, the maximum that we recommend that you do this for is 2 minutes, because you're going to get really tired whilst waiting for the paramedics. If there's bystanders here as well, what we want is a defibrillator on the scene, so that we can start that process. Defibs are really easy to use, and they'll talk to you and give you lots of instructions about what to do. So they're the things that we need to get ready. We just keep doing that until the paramedics get there, or until there's a recovery from the child. Okay. So children, that's how we do CPR with those. Let's have a look at babies now. Right. So little one. So this is under the age of 1, so 0 to 1. Now there are a couple of changes with the infant. Now first of all, the big thing with them is their airway really. So we will go through the same process, danger response, airway, breathing, and then we would put the 5 rescue breaths in and then start compression. So it's exactly the same as the child. However, the airway is a little bit more delicate, and what we don't want to do is really tip their airway back. Their airway is a little bit like a drinking straw, so all we do is if we bend it, it kinks, and it'll actually close their airway. Now babies have got a really big bulbous head and a big gap in between their shoulders. So something like a nappy or a baby grow, just sort of wedged underneath, okay, is going to maintain that airway for you. Okay, so we would do exactly the same with the infant. If it's a newborn, you won't be able to pinch their nose and seal the mouth. It's okay just to put your mouth all the way over their nose and mouth as well, and that will get the seal so that no air can escape, and we're going to push the air into the lungs. This baby model, I'm going to need to pinch the nose as well. So I'm going to put our 5 little rescue breaths. Obviously, I'm going to adapt the size of the breath into the baby. I'm not going to put the same amount of air into the baby as I do into Billy. So 5 little rescue breaths. 5 of those. And again, just to adapt the amount of force going through the infant, I'm going to use 2 fingers this time. Okay, so we're going to put those right in the centre of the chest, right in between the nipples, and we're going to push down with 2 fingers. And we're now on to 30 compressions. Okay, so we've done our 30 compressions, straight back into 2 breaths, and then straight back onto 30 compressions. Now, we talked about the depth of the compressions, but the speed. I mean, there's lots of songs out there. I learned with Nelly the Elephant. The big popular one at the moment is Staying Alive, the Bee Gees. It's the rhythm that we're really interested in. It's between 100 and 120 beats per minute, so nearly 2 per second, so it's pretty quick. Now, what we're doing with CPR is the heart is a big squishy bag of blood. All we do is we squeeze the blood out and then we let it recoil as well. So the recoil is as important as the compression, because if we don't let it recoil and refill full of blood, we're just doing that and the blood's not going to get around the system. So it's really important. Obviously don't bounce around on it, but it's really important that we let that heart refill as well. It needs to be done on a hard surface as well. So if the child's in bed or on the sofa, they need to be on the floor. All you're going to do is you're just going to compress the mattress or the sofa cushions, and whilst you're doing that as well. So that's baby and child CPR. It's pretty simple. It would be very stressful. However, you are giving the child the best chance of survival. So just remember your Dr. ABC. So check for danger, check for response, check their airway. Then we're going to check for breathing, and then if they're not breathing, we're going to call for help. Okay, we're going to call the ambulance, and then we're going to provide their circulation for them by 5 rescue breaths, then 30 compressions, 2 breaths, 30, 32, 32, 32. Right, so that's child CPR done. Lots more content on our YouTube channel, so have a look at those. We do go out and train baby and child first aid training courses for professionals, for schools, for teachers, as well as all our first aid work courses as well. So do check those out. Now I'm going to hand you over to Rachel, who's going to look after the children's minds. So we're going to provide some first aid for children's mental health, and have a good session with Rachel, and I'll come and say goodbye at the end.
Wow, amazing and priceless information there from Paul. I'm sure you will all agree with me. And in the same way that Paul has been brilliantly demonstrating ways to protect and look after our physical health, we also have our mental health to look after, or first aid for your brain, if you like. My name is Rachel, and I'm proud to be part of the team at Bouncebackability. Now that's where we help empower and support people to overcome obstacles that are happening in their life, putting them back in control of their own destiny, if you like. I'm a fully qualified master NLP practitioner, so that's neuro-linguistic programmer, and I like to describe NLP as a way of sort of rewiring the brain to a new, more useful way of thinking. So whether someone's got a phobia, anxiety, suffering panic attacks, stress, then NLP can help to really unravel this behaviour and create a new, more helpful way. Now, our mental health is just as important as our physical health. This is where we focus on our feelings, our moods and our thoughts. You know, those little pictures and movies that we sometimes play out inside our heads, and sometimes they're really good scenarios and great movies to watch, and sometimes they can be not so helpful for us. And if we can think about it like a set of traffic lights where there's been a disruption to the main computer that keeps them working correctly, and we can start to get them turning the wrong colour. So for example, the green when the cars should be stopping, and then red when they should be going. This would completely throw the road into chaos, messing up all the cars, going the wrong ways, lots of horns beeping and tooting, I would imagine, creating lots of disruption. Well, that's kind of what happens when one of those unhelpful movies gets a little stuck in our mind. We might be feeling down, angry or upset at times, and that's a normal part of life, just the same way that feeling happy, confident and carefree are. So having good mental health is about experiencing these range of different emotions. It's not always about being super happy. And a good habit to adopt is to reassure your child that it's perfectly normal to feel these ups and downs, and it's okay to reach out and talk about them. A really good way to get this across is to let them know perhaps about a time when you were nervous or anxious. For example, that might have been a job interview, could have been sitting your driving test. This just lets them know that they are not the only ones with these feelings. And then you can chat about perhaps some breathing techniques to help them. So one of them would be in for a count of 4 and then out for a count of 7. Or perhaps for your child it might be drawing a picture to demonstrate how they're feeling, or listening to some music. But get them to change the focus of attention and allow that feeling to pass. And if this is perhaps too difficult, or your child saying things like, I don't know why I'm sad, or I'm just feeling a little down and don't know what to do about it, then a great tip is for you to write down some words on some post-it notes and lay them out in front of them. Could be words like afraid, nervous, frustrated, lonely, worried. Sometimes once the child sees the words, it's a lot easier for them to just point and communicate how they feel, rather than them having to think about it, if that makes sense. And this again can start a conversation, and that might be a little easier for the child to let you know how they feel. You can take this a little further by getting the child to perhaps scrunch up the worries, the words on the paper they're drawing, rip them up, throw them away. Or it might be sticking those post-it notes onto a balloon and sending all their worries and thoughts away up to the sky. These are just a couple of techniques that I use when I'm engaging with anybody really, but particularly children. It's a great way as well. Another one is for them to be their own superhero. A special secret technique that they can learn, where I get them to imagine what they would look like as a superhero. What would they wear? How would they sound if they were that confident person that they want to be? How would they look when they're full of confidence or full of calmness, or whatever resource it is they felt they needed to help them to get to a different situation? And getting them to build this picture inside their head proves to be really powerful. And then we can get them to step in and be that person, be their own superhero. That cloak of confidence that they're now wearing, that no one else can see, is sometimes enough just to get that child over a hurdle that they would experience. We will discuss this further in our next workshop, but that's just a couple of suggestions for now to keep you going. And what's possibly happened inside your head is it just got a little bit scrambled, a little bit overloaded, and it's running one of these not so nice movies that we spoke about earlier. And the brain's just choosing the best resource available at the time. Now this might be lashing out, whether it's verbally or physically. It might be being a little bit quieter than normal, a bit withdrawn from friends and family. They might have no appetite suddenly. But this is the only way that they know how to process what's going on inside their mind at the moment, and the only thing they're in control of. So where the techniques I mentioned will come in very useful is like, if I can give you the example of a lemon. And if you start to think about popping that slice of lemon in your mouth, yeah, you've got it. As soon as you start to think about the lemon going in your mouth starts to water, doesn't it? That's the very same thing then that's happening inside your child's mind. And they've just reacted to a thought that they had. Just in the same way that you've just reacted to thinking about eating a lemon, and you've processed it and your body's reacted to it. So to sum up, folks, in the same way that Paul gave us loads of important techniques to look after our physical health and what to do when things go wrong, it's just as important that we're equipped to look after our emotional health, to be able to keep ourselves well and safe. After all, if we were unfortunate enough to say break a leg or had bad earache, then we wouldn't hesitate, we wouldn't just ignore it and expect it to heal on its own, would we? No, no one would. We would just say, no one would say snap out of it. We would get some help to fix that broken leg, and we'll get some advice, because after all, looking after our brain is no different. So I hope you've really enjoyed this little taster session, and if anyone has any questions, I'm Rachel at Bouncebackability. You can find us on Facebook, Instagram, Twitter, where there's also some links to our child hypnosis sessions as well. Thanks for taking the time to listen, and if anyone has got any questions, just feel free to put them in the chat room.
So thank you so much for that, Rachel. That's really, really insightful. Very, very useful. I've got two boys that are quite anxious about getting back to school, so I'm going to take some of that on board as well. So thank you so much for joining us today. We hope you found it really useful, enjoyable. So check out the Bouncebackability Facebook page for all the information about the services that they provide. And also check out, we've got a very active Facebook page for Green Box First Aid Training, and also our website as well. And we look forward to seeing you again soon. Thanks very much. Bye-bye.